Corneal perforation is a sight-threatening complication with numerous causes including inflammation, infection and trauma. Key principles to management include swift recognition, treatment of the cause, and implementing the appropriate intervention to promote healing. A diagnosis of corneal perforation is usually unambiguous with a constellation of clinical features. These are an overt perforation site, corneal thinning, leakage, pigment in the wound, and shallowing of the anterior chamber. Corneal glue is an effective intervention for small perforations, usually 2 mm or less in size. Each perforation requires personalised care. You must treat the cause and the patient. In this short video, I will take you through the steps to perform a corneal glue. You will need spears, a speculum, a gallipot, any lid drape, a scalpel blade, forceps preferably corneal, a 3 mm punch biopsy, chloramphenicol ointment, a bandage contact lens, cyanoacrylate glue. Preferably the patient is treated in theatre, a clean room, or if conditions are right, at the slit lamp. The first step is to prepare your equipment and have the following opened at the ready on a sterile field: the glue, chloramphenicol, the gallipot, punch biopsy, plastic drape, bandage contact lens and spears. Next, instill topical anaesthetic. Place a speculum, taking care not to exert any downward pressure on the globe. Next, identify the perforation site using forceps, preferably non-toothed, and clean and debride the epithelium around the site using the forceps and a scalpel blade. This will improve glue adherence, which is important. Dry the perforation site using a spear. Now lay the plastic drape over the gallipot and using the punch biopsy, carefully punch out a disc. If the disc gets stuck in the punch biopsy, you can carefully use your forceps to retrieve the disc and place it on top of the gallipot. Now a small amount of glue is applied to your gallipot. I recommend dabbing 3 times to get the right amount. Next, dab a small amount of chloramphenicol ointment. Then, using the handle of the spear, carefully dab a small amount of chloramphenicol, pick up your disc, and then dab a small amount of glue onto the disc. The glue does begin to dry, so moving efficiently but safely is essential. Carefully place glue with disc over the perforation, ensuring the whole perforation is covered. You can use the forceps to help place the disc. Allow the glue to polymerise and dry adequately. Once dry, carefully place the bandage contact lens over the cornea. Remove the speculum, again taking care not to exert any downward pressure on the globe. Once the procedure is complete, continue the essential principles of management, that being observe the patient closely, continue to treat the cause and optimise healing through medical management as well. Remember to bear in mind other surgical treatments if the glue fails or if the perforation is larger, such as conjunctival flaps, amniotic membrane and corneal grafts, including patch or full penetrating keratoplasty.